Get off the rat wheel.
Hello, everybody. This is David Coffey with Enhanced Care. Thanks for joining me tonight on this webinar on February 26th. We really appreciate you coming. This theme for our webinar tonight is Enhanced Care Smarter Choices after Open Enrollment, which seems to be a lot of questions for people. Well, we've got some special things we're going to talk about tonight, and we're going to move right along and share this presentation. But at the same time, we're going to have questions and answers afterwards that we're going to take live to help you through it. So let's get started, because I know a lot of people are saying, well, what do we do after an open enrollment? And here's the good news. Here's the reality. We're going to be talking about open enrollment's been extended, but let's share the whole value of what we're doing here. So, Five Links has really done something special for you guys. They have provided you healthcare products, services that help everybody in the world, or we're now focused on America, but let's think about the future, how we're expanding, right? So, Five Links has put together through Enhanced Care these three products. We have our EnhancedCareMD program, our EnhancedCareMD Connect, and then the one that we're really focused on is the EnhancedCareMD Smarter Choices. And so let's just talk about it, because what these healthcare products really help our members pay less for care and get better outcomes, meaning they get the most appropriate level of care each time they do. And so let's talk about EnhancedCareMD. It's the virtual healthcare solution, which you can call one of our doctors 24/7, 365 days a year. And this is the great thing. For $5, you're able to have a consultation. And you're going to need to know this number for anyone that has a high deductible plan, which is the majority of Americans that have health insurance. They first have to pay for the full value of their services until they meet their deductible. And so that's generally the national average cost of a physician visit is $150. Well, our is $5 over the phone or via video. So really inexpensive, but affordable and convenient. Access to our 24/7, access to our nurses. Our nurses are going to be able to guide you to make sure that you're going and choosing the right method of care. So sometimes it doesn't make sense to go to the ER or urgent care or the doctor. There is a self-remedy, and you know what? A third of the time of our members, when they call our nurses have a self-remedy. Not all the time, but a third of the time. So what a great solution. Instead of going to the doctor and spending too much, get the right thing. And then we also include in that same program is our Walmart prescription savings plan for prescriptions. And you're going to hear more, but 70% of American families have over $2,000 worth of prescriptions every year. Why not be able to help them right away by using our program? And then we have our holistic care, our mind, body, spirit educational portal, which is key. And that plan is $29.95 for a family per month. We have our Enhanced Care Connect. And that program, for anyone that doesn't understand, these are pre-negotiated, it's a medical discount program with pre-negotiated discounts to over 500,000 healthcare professionals, including dentists, vision care, hearing, chiropractors. And why I focus on those areas is because those things are not covered in health insurance. A lot of people think when I get health insurance, oh, I'm covered. But you know what? You don't have coverage for dental, vision, hearing, chiropractors, acupuncturists, and those things happen, and people are using them, and they're paying full price. Why not get pre-negotiated rates for over 500,000 healthcare professionals? So it's a great program that you can start saving immediately. And so what we did with our Enhanced CareMD Smarter Choices, we took the two plans together, our Enhanced CareMD and our Enhanced CareMD Connect, and we bundled it together and added our access to our private health insurance exchange. And I want to pause there. It's our members only. You have to be a member to be able to get access to see this ease of use, being able to shop for health insurance, find the right plans in your market, be able to find out if you get a federal subsidy and qualify easily, and do it all conveniently from online or with one of our live brokers. And so what a great win that we're offering there. And that's where we're getting a lot of traction right now with open enrollment. Now, open enrollment was supposed to finish in February, but the government has realized, oh my gosh, here's the reality. People are now believing that, oh my gosh, it is true. I'm going to get taxed a penalty because I didn't have health insurance in 2014. And so people are saying, geez, I didn't get a chance to get it during open enrollment. So government is allowing you a little bit more time, and we're going to talk about that. So the EnhancedCareMD Smart Choices is a bundle of both of our programs and gives you access to our health insurance marketplace where you can buy the most affordable health insurance plans out there for $49.95 per month. And I'm going to show you, and you're going to show your friends and family that $600 a year is inexpensive because it's truly your family's personal health security system, and you're going to need it. So let's go to the next screen. So what do you have to offer Smart Choices after open enrollment? You can sell Smart Choices every day, 365 days a year, because you're going to help people pay less for care because it's the bundle of our services. It's the best value plan we have. So you could sell Smarter Choices to friends and family who have high deductible plans, because remember what high deductible is. That first $2,500 to $5,000 to $11,000, some health insurance plans are high deductible plans. And you're going to need to pay that first before health insurance actually kicks in and helps you. And you're still paying your premiums. That's why you're going to need our services like our nurse, our doctor, our prescription plan, our medical discount program. Those things are going to be really important to keep those out-of-pocket expenses as low as possible. Our goal for you is to keep that cost as low as possible and never hit the deductible, so you never have to actually use the insurance part. Keep yourself healthy. So high deductible insurance plan people that already have health insurance, if they bought it from us or for the government, from healthcare.gov, show them that there is value with this $49.95 plan. It's the best value plan. Help them save their out-of-pocket expenses. And then you want to help anyone that missed the open enrollment, because guess what? Open enrollment's been extended. And yes, you need to sell this right now. And we're going to talk a little bit more on the next screen. So anyone that doesn't have insurance, you know what? Smarter Choices is better than nothing. It's a great plan. It's not health insurance on its own, but it gives you access to health insurance. And it gives you access to affordable care when you need it. And then anyone that's turning 65, and there's over 10,000 Americans every day that are turning 65 that need to start shopping for Medicare. It's required. And so they have within 90 days of their birthday to pick a plan. Sell them Smart Choices because we have a better way to help them shop for Medicare and guide it through them. And then if you have a qualifying event, and we'll talk to you about what are those events that will qualify for you to get health insurance during the course of the year. The other great low-hanging fruit opportunity is the Smart Choices for small business owners. Anyone under 100 employees, this is a great win. Help those business owners get out of group insurance plans into the private exchange and start capping their costs, giving their employees more value and more access to the services. And we're going to talk a lot more about that later. And I'm only going to talk about large businesses right now in this small segment. Anyone that has a business over 100 employees, this is my recommendation. Of course, you can talk to any of them that if they already have health insurance. But if you're going to have to spend your time and energy, I would focus on if you happen to have relationships with a large business, anyone over 100 employees, talk to the ones that have no insurance, because you're going to share with them that there is a real penalty. It's $2,000 per employee that they're going to be assessed at the end of this year if they do nothing and offer no health insurance, because large businesses are required to provide health insurance, and so, or access to. And so we can help them with our Smart Choices plan with a group plan. So we do a combination of the two together that makes the solution for them. And we can keep our cost low for them and help them avoid those tax penalties. So it's a great opportunity. But honestly, friends and family, small businesses are much lower hanging fruit. The large business one's going to take some time and effort on your end as well. So, but we could do that selectively later. Let's go to the next part. So what we're suggesting to you after open enrollment, when there's no qualifying events, promote the savings and the convenience of our services. You need to share personal stories. So that means you have to have the plan 5 links reps. It's really important to have it. You need to use it yourself, believe it, have those experiences to share. So you could start saving by calling our doctors right away. For $5, on flu symptoms, sinus infections, earaches, urinary tract infections. There's so many more. You start saving on prescriptions for Walmart. Again, as I said, 70% of families have over $2,000 of prescriptions a year. If you just take our average saving of 33% off that $2,000, right there alone is our entire year's worth of savings in our membership. $49.95 times 12 is a little less than $600. You're saving less. You're saving that $600 right away on the average family in prescriptions. But I know we can save you more. Use it for our dentists. Come on. Health insurance does not include dental. So adult cleanings, cavities, oral surgery, orthodontics, there's so many things that our dentists have pre-negotiated rates that is so much better than dental insurance. But if you still need it, you can. You could spend that $1,000 a year on dental insurance if it makes sense for you. And we can offer that. But I'm just sharing with you that our pre-negotiated rates are great. Same with our vision care, get eye exams, frames, contact surgery, LASIK surgery at pre-negotiated rates, better than you can if you did it, if you paid directly yourself. And then one of the biggest values, our nurse. You call our nurse 24/7, 365 days a year, and our nurses are going to be able to help and guide you to make the most appropriate level of care. It is a great value when you need it most. So there's so much more value. These are just the highlights. But you need to have your own personal experiences and share. So we're sharing here what the average cost, and we absolutely believe if you can use this slide to be able to help, you need to share your own personal stories or testimonies. That truly works the best, but this is a way to say, this is how much you could potentially save if you're an average family of 4. $2,400 right away. I'm finding the less risk of a claim, a lower premium plan, higher deductible plans. We're saving our members $2,400 with a family of 4 right off the bat by helping and guiding them to the most appropriate health insurance plan. When they start using our services, like our nurses, you'll remember, as I mentioned to you, a third of the time, most people think they need to go to the ER or urgent care or to the doctor, and that third of the time, our nurses actually have a more the most appropriate level of care, which is self-care, and so you're saving money right off the bat. If you could avoid an ER visit, an ER visit's $1,400. Think about the time you're saving just with our efforts of avoiding with our nurses. And then when you do need a doctor, you could use our telemedicine solution, and instead of paying the average $150, you're only paying $5, so keep that $145 in your pocket. Our Walmart plan is almost $600 in savings on an average family basis. I mean, this is huge savings, and we're already calculating up to $5,800 per year for a $600 investment. This is a huge benefit. And now you use our medical discount plan for dental, for vision, for hearing, for other various things, and now you've added another, $2,000 in savings. So we absolutely believe we can help our members with a 1-year plan for an average family of 4, almost $7,500 in savings if they use our services to the level that they should. So what a great way to help stimulate friends and family and business owners. And so here it is. Can we offer health insurance now? The answer is absolutely yes. So sell now because open enrollment has been extended through April 30th. And that's key. Tell them you have just been given a gift. Take advantage of it. Don't delay. Seize the day. Qualifying events also occur during the course of the year that you can purchase insurance anytime, and those are marital status changes, births or adoptions, you lose a job, or you lose health insurance coverage for whatever reason, or you move. Those are the normal qualifying events. Now, there's an open enrollment extension option that you can select through April 30th of this year. So an important piece. That's not going to happen every year, so don't count on it. Get it done. So also, if you're, as I mentioned, if you're turning 65 or you know someone is turning 65 this year, within 90 days of their birthday, they can start looking at better Medicare solutions. And I'm telling you, our Smart Choices transition is a win. You need to get them to purchase our plan, help them get through the transitions, product, service, help them pick the Medicare plan because it's really confusing. And we give each Smart Choices member that's using our transitions a dedicated caseworker to help for all senior care decisions. That means long-term care, nursing care, and so on. So it's not just buying Medicare, it's throughout their whole life if they stay with our plan. So it's really simple and valuable. But now let's talk about that low-hanging fruit, prime targets of small business owners. You could sell small business owners any time of the year because they're constantly changing their plans. It's really the right time is to help those businesses under 100 to find a better solution. And Enhanced Care Smarter Choices is really the best approach. So let's talk about it. Why is it better? Well, first of all, the small business owners are not required, like the larger companies are, to provide health insurance through because of the ACA, Obamacare. But here's the thing, 56% of business owners think they have to provide group insurance, and they don't have to. 70% of business owners already offer something, but they don't have to. And if you could show them a better way, a way to give better services to their employees while lowering their cost, what a win-win-win. Everybody wins. So what it is you're going to sell them the Enhanced Care Smarter Choices plan by replacing their group insurance plan, by moving their employees to our private exchange through EnhancedCareMD Smarter Choices. We're going to be able to help those employees find a better premium plan. At the same time, the employer gets out of the business of group plans, so they don't have to manage that. And our services help them more than just getting insurance. It's all the other related services that help, from a consumer standpoint, make more sense. And we give, because we're moving them to a private exchange, meaning individual purchasing, they are eligible for federal subsidies. Group insurance plans exempts the employee from getting, because they can't. If they have group insurance, they can't get a federal subsidy that may help them lower their costs even more. So it's a great win for employees as well. So this is where the companies benefit. You're going to have them shift from group plans to individual plans without any penalty. This will allow the employer to get out of administering the healthcare coverage and absorbing those cost of increases each year. And so this allows the employer to be able to manage their staff better, and they get out of that reoccurring issue. And it complies with the ACA, so they don't have to worry about those premium increases each year. They're out of the business, and they're giving their employees the ability to manage that with our services and being able to use for federal subsidies, and it's a great solution. So it reduces, and this is a big piece, it reduces internal costs associated with managing the benefits. And what that means is they can shift their focus during those times away from managing that benefits and just continue to offer our smart choices. And so this is how it works. Even if the employer wants to contribute more, they can. So that's a lot of times when we've sold the plan, they say, I want to give a little bit more than just the Smart Choices plan, which is great. You buy the Smart Choices plan for each employee, which includes for their entire family the $49.95. And then the employee can supplement through payroll adjustment, meaning they can increase the payroll to cover the portion that they wanted to contribute. And then that can add more value to their employees and allows them to buy the plans that make most sense. And the employer, the company, gains more intangible benefits as well. Increased productivity, reduced lost time because they're using our services like our virtual, calling a nurse and our doctor instead of always going to the doctor and taking time away. You could do a lot of those things over the phone, and it saves time and convenience for everybody. And this is goodwill that's going to be sustained year after year because the employer is going to continue to offer the Smart Choices solution with our services in the marketplace because every year the employee has to go and renew their plan. And the benefits are boundless with the employees. Employees benefit even more with Enhanced Care because of our services. And now they can pick the right plan and choose the right plan instead of, sometimes the employer can only pick one plan. And so it has to fit everybody's needs, but it doesn't always fit everyone's needs. And so now the employee has the ability to choose the right plan. And they can immediately start benefiting from the savings of our services, our nurses, our doctors, our RX plan, our discount medical plan for dental and vision. And so we're saving anywhere from that range of $150 to $350 a month with our services. So big savings for everyone involved. And now the employees are eligible to find out, to get access to federal subsidies. Doesn't mean that they will get a subsidy depending on their income, but if they do qualify, they're now possible they can get it. But with group plan insurances, they couldn't. It exempt them. Now it's possible for them to get federal subsidies to cover some of their costs of their monthly premiums through their health insurance. And we also offer ancillary benefits as well, which helps them, like life insurance. And many employees are looking for that. And we facilitate that through our Smart Choices Marketplace. So we've made selling to businesses and positioning it really simple and easy. We've given you these selling tools. We have a fact sheet that you're able to leave behind, which is really important because many business owners want to read it and absorb it. But we created a genie. We created a website for lead generation. It's called EnhancedCare.chgenie.com. It's right on the screen. That's a website. Go to that website and share that with business leads, because they will go through that, understand the direction that we're working for small business owners, and then you're going to encourage them to fill out that lead. I'm interested to get contacted, and you're going to encourage them to put your RIN number in that area, and then collectively, you and I will call them together and work with that business owner to get them the right plan that makes sense for them. And that's smart choices and guide them through the process. We also, after we receive that lead, this is how it works. We get that lead through the Genie. We then send out a census report to the employer to fill out, because we need to know how many employees we're talking about and how to work that. We're going to use that census report to upload into our system to gain access to their Smart Choices plan for them. So this is a really important piece, and you have that census form in your back office to be able to pull that down. It's an Excel spreadsheet that you want to forward. And we also have an ACH authorization form that needs to be signed and authorized for us to pull the funds out of the company's bank account each month at $49.95 per employee. So we do this, and therefore we're not charging them at this moment the setup fee, because we're using the ACH process. And they're authorizing us to pull the funds out. So it works out really well for everyone. And this is how it works. We'll take that census form, we'll take that ACH, we'll get it all set, we'll communicate with the owner, and then we'll enroll all the employees using that census form, creating the Get Started packets. If we have their emails, we'll send out the Get Started packets and the invitation to shop for health insurance automatically, which works out really well. Now, we found out sometimes that some employers don't have their employees' email addresses, so we've got to work around to do that. But we're going to need your help. As the 5 Links rep, the person who sold the sale, and you're going to get credit for this, we're going to ask you to host an open enrollment session, meaning you're going to take them, you're going to open up your Smart Choices plan, and you're going to show the employees one night how to navigate and use the services and how to shop. So that is going to be really important for you to have that relationship with that business owner, because you're going to do that together, because that will build more credibility, and it will lock that employer in with you and know that they value you and the services that we're offering. And then we're going to continue to send emails, and we'll do some follow-up phone calls to help those employees get signed up and get started. And so we'll do that, and you don't have to worry about it. So remember, you've got so many tools. You've got the documents in the back. We've got this webinar to help you train to fully understand. We have case studies and other presentations that we've got, and we've got, most importantly, the EnhancedCare.chgenie.com, the lead generation thing that will help you, site that will help you guide and get people excited about our program. So think about this. 5 Links to healthcare solutions are vast. We've got those 3 options, but really, Smart Choices is the right time, the right place. The Americans are looking for a solution. Help them right now. Right time, right place, right product, right opportunity. So thank you all so much. We're here ready now for questions and answers, and my good friend, Mr. Rick Popovic. Rick is going to be taking these questions for us. Thanks so much.
All right. Thank you so much, Dave, for that great presentation. And as Dave said, we will now bring on Rick Popovic, who will answer some of the questions that you guys have. He is another member of the Enhanced Care team. Also on the line, we have Keith Adams, who is the 5 Links product manager for the Enhanced Care product. So welcome, both of you, Keith and Rick. You guys there?
Yeah, I'm here. And hello, everyone. Hey, good evening, everyone.
All right. Great. Well, so far we've got just a few questions, so before I start asking you guys to answer them, I just want to encourage all of the audience to be sure to type in your questions so that you get them answered tonight or in the next week or so. All right, so let's go ahead and get started with our Q&A. Our first question, I believe, is for probably both of you could answer this, but I'll throw it to Rick.
Sure.
The first question is, how much for the enhanced care bundle for individuals?
Yeah, the bundle's the same price for individuals or for family. And remember, it's a household. So if you have other people in the household, doesn't have to be a direct family in the sense you may be thinking. But it's the same price for individuals as for families with the bundle.
All right, easy enough. Great. So then our next question is probably one that I can answer, so I'll go ahead and do it. The question is, will the PowerPoint be available online after this webinar? And the answer to that is the actual webinar will be available online as a recording, and you can access that through our webinars site, which is at webinars.fivelinks.com. There's a webinar library tab, and you just click that, and you can see all the webinars that we've run since we started doing webinars way back when. Probably a couple years now we've been doing them. So be sure to check it out. Again, that address is webinars.fivelinks.com. All right, and one more thing. It'll be available in the webinar library tomorrow morning, so you won't have to wait too long. All right, our next question is probably for you again, Rick. For a company over 100 employees, if they buy the bundle for $49.95, they would have access to the marketplace, right? If so, would it be $49.95 for each employee?
Okay, well, that's a two-part question and a really very different two-part answer. Let me answer the second part. Yeah, the bundle for any company, doesn't matter what size it is $49.95 per employee. And what the employee gets out of that, of course, is all the things you just heard Dave talk about. So, the real question, though, is this question started with over 100. If it's over 100, they don't have access to the marketplace at all. If it's over 100 people, over the 100 can't get the individual marketplace. So, if it's a company over 100, we could look at trying to provide other group insurance for them, a low cost, minimal essential coverage plan or something like that. But for the rest of it, if they're over 100, they don't have access under any circumstances to the marketplace. If they're under 100, they do. Yeah.
Great. Thank you for clarifying that, Rick. I'm sure that is probably a point of confusion for a lot of people.
Sure.
All right. So our next question then, can we as reps see what is offered in the marketplace now without being signed up?
And I can answer that. No, you as a rep, there's any number of reasons why you should be signed up for the bundle. Our marketplace, our exchange is a private member exchange, so you have to be a member of the Enhanced Care Smart Choices. And once you are a member, then you can go in and see not only what's there for yourself, so you get all the benefits, again, that Dave talked about of the Smart Choice bundle. You'd also have access to the marketplace, and then as you're selling to other people, you could pull up you could plug in their information on the portal and be able to see what's available. So the short answer is yes, you have to be a member.
All right, good to know. Again, this next question is for Rick. If a customer buys insurance through a broker or an insurance line, does the rep still get credit? Would the would the customer have to give the broker the RIN number?
Okay, well, that, again, I think there's some confusion on this. If they're buying insurance, if the customer buys the insurance through us, so let's just be real clear, and we just talked about this today. Matter of fact, in our weekly meeting with 5 Links. This again, it's a private exchange, so all 5 Links is selling is the bundle, and the bundle gives people access to the exchange. Anybody that decides to buy insurance is going to buy through a broker, through our broker, and your RIN number would be part of that. You would get credit. You're not going to get a commission because we're not selling insurance, but you would get credit for that sale. So again, you have to be a member. You're not selling insurance, but you do get a compensated, but it's not actually for selling the insurance. And they are going to buy through a broker. So if that's what the question meant, if the question meant if they buy it through some other broker, no, they obviously wouldn't get any credit. Wouldn't have anything to do with it. But I'm not sure that I understand the question completely.
Yeah, and if I can just add, in our meeting, they said that they would receive a marketing fee, not to be confused with commission, like Rick had just said, but a marketing fee.
That's correct.
We're not in the insurance selling business.
Yeah, even Enhanced Care doesn't sell insurance. We have an exchange to give you access for the insurance. So it's really critical that everybody understands that you'll get a marketing fee, but your first and foremost and biggest amount is going to be for selling that bundle, because that's really what we're in the business for, to sell that Enhanced Care Smart Choice bundle.
Okay, so then this next question you probably already somewhat answered, but I'll go ahead and let you elaborate on it. Is there a way to quote insurance to a potential customer without having the Smart Choice bundle?
Yeah, so short answer is no. You have to have the same answer I gave before. So the only way that anybody can see what the insurance might be is through being part of the bundle, and then that information goes to a broker who will get the actual quote.
Okay, great. Next question is about how you approach business owners. So this person wants to know, what is the best way to approach business owners in marketing the Smart Choice program?
Yeah, so best way. That's a loaded question. What is the best way? The way that you should be doing this is first of all finding out. Let's talk about the small companies under 100 full-time equivalent employees. If there's a couple of questions you should be asking them. One is, are you providing insurance for your employees? And if they answer yes, your question to them back should be why, because they don't have to. Now, I don't know if it was in Dave's presentation or not, but 70% of all small business owners are still providing insurance, even though they don't have to. And of those 70%, 40 points of those 70 points, there are people that aren't even aware that they don't have to. So in other words, some people still want to give something because they feel they want to help their employees, but clearly 40% of people don't even know that they don't have to provide it. So if their approach is that they want to take care of their employees, that's why they're doing this. You can explain all the benefits of the Smart Choices bundle, which is a great benefit for them. And by the way, if it's a company that currently is providing group insurance for a company under 100, and they canceled their insurance policy, their group plan, that's going to be actually better for the employees than the employer would think, because what it gives the employees is a couple of things. Number one is they can go in now to the exchange. Even now, when the open enrollment period is over, they can go into the exchange and find a plan that better suits them, their particular needs. But maybe more importantly, they would qualify for the federal subsidies, which under a group plan, they don't. So by doing what appears to be taking something away from employees, and that it would be canceling the group plan, the employer is actually giving them more. And if the employer pays that $49.95 a month for the people, gives them the access to the exchange, that employee is better off in every conceivable way, because again, they get all those benefits of the Smart Choice bundle that Dave talked about in his presentation. So it's a long answer, but best way is to hit them, find out what is it that's driving them. Is it cost, or is it trying to take care of their employees, or both? Excuse me. Okay. Are you still there, Charity? Keith?
I'm still here, Rick.
Okay. Sorry about that. I was on mute.
Okay.
Sorry about that. I was just saying that I think you hit a lot of good points in your answer to that question. And I think you were emphasizing the importance of the reps really finding out from these employers what it is that they want to give their employees from the Smart Choice program. So it's really about targeting the right market and understanding what the customer needs.
Yeah, I mean that's really the key to any sale. In any business, it's finding out what's that customer's itch, and what do you have that can scratch it. And it's just such an easy thing, because it's on everybody's mind with insurance and with healthcare, and asking that simple question of do you provide, and it's virtually any company that you know, any small company that you should, ask them that question. If I'm in a restaurant someplace, I don't know the people, I'll ask them, hey, what are you doing for your employees? And if they say, well, we're providing group insurance, I'll have a conversation with them much to my wife's chagrin, but I'll have a conversation with them, because I know I can save them money, because they don't need to do that. So it's a real opportunity out there. And again, whether they want to take care of their employees or they're trying to save money, and that's generally going to be the only things that are driving them, you've got a solution for them, in the Smart Choice bundle and with the insurance, or even without the insurance. Remember, the other thing I want to emphasize here, Charity, is that we've been selling the bundle, if you will, for 3 years without insurance. So everybody should still be out there, selling Smart Choices, the bundle. Having the insurance is just an extra benefit for people, but people with insurance already you should still try to sell them the Smart Choice bundle, because that's really what's going to save them the time and the money and be more convenient. The things that Dave talked about during his presentation.
That's a very good point, and that needs to be sold to people who have insurance for their companies without going to the market.
Okay.
All right. So this next question is more about the personal insurance, and it's probably an opportunity to review what Dave covered in the presentation about how the insurance marketplace works.
Right.
This person says, I'm retired and I missed the open enrollment deadline. So how much more will the full health insurance cost me besides the $49.95 for EnhancedCareMD Smart Choices?
Well, okay, now that's another loaded question. So retired over 65 or under 65 is really the key. I'm going to assume by the question that it's under 65, because they didn't talk about Medicare. It's the open enrollment period, and I want to make this really, really clear to everybody. The open enrollment period was extended but only for people that had already filed their income tax and found that they owed a fine last year. So there's still going to be millions of people involved in that, but it's more narrow. So if the person that asked this question, if in fact they had filed their taxes and found out that they owed a fine from last year, then they can qualify for it. How much more to be than the $49.95 depends on your circumstances and how much money you make, because depending on your income, you may or may not be able to get a federal subsidy. And that's one other thing that people aren't, most people aren't aware of, that the subsidies aren't just for people that are really poor. We have people that are making $75,000, $80,000, $90,000, $100,000 a year that are getting federal subsidies because they've got 4 or 5 kids. Even with like 3 kids, you can still, those subsidies are there to help people to offset the cost of that insurance. So the answer to that person's question is I don't know how much it'll be. It depends on where you live and what the insurance is and what your circumstances are. But it is over and above the $49.95.
Okay, thank you for clarifying that, Rick.
Yep, okay.
Next question is, how many do you consider a family, and is there a limit?
Yeah, there's a limit on the doctor's side. So when you have the Smart Choice bundle, the limit is for being able to use the doctor. In other words, have names in the system. It's a family of 5. On the nurse, there's no limit, and on the Walmart, there's no limit. So generally, what we say as a household is 5 people. And I emphasize household as opposed to family because it could be that you have a mother-in-law living in your household that wouldn't, under normal circumstances, be considered part of your family. That would be for us. So for the bundle, it's a family is considered 5 people for the doctor use only.
Okay, great. This next question, again, is probably a clarifying one, and maybe it would be a good opportunity, Rich, for you to explain the different components that make up the Smart Choices bundle. I know that Dave covered that in his presentation, but I think there are some people still confused by it. So this next question is, this is not insurance, so do they still have to get health insurance?
Okay, let me answer the question first. The direct question is, yes, they still have to get health insurance, whether it's through us or through somebody else, yes. And what the bundle gives you, there's various pieces of it. There's EnhancedCareMD, which is the 24-hour-a-day nurse, the 24-hour-a-day access to a doctor for $5 on the phone or the computer. There's a prescription plan, not a discount, but a prescription plan with Walmart, wherein our people are saving about 33%, a little over 33% on their prescriptions. Then there's what was the EnhancedCareMD Connect, and the Connect is direct access in person to almost 1 million providers. And those providers are doctors, they're various specialists, they're dentists, they're vision specialists, they're hearing specialists, they're chiropractors, acupuncturists, goes on and on and on, in addition to discounts on things like health clubs and weight loss and hard medical equipment, et cetera, et cetera. So all of that is what people are getting to help them save costs. The way to look at this is the Smart Choices bundle saves you money when you need care and gets you the right level of care, and the insurance plan that we offer you is going to help you to get the lowest premium without worrying about being underinsured. So that's the easiest way I can have to say that.
Okay, I think that was a really important clarification to make, and I think that is one area that people still get very confused about, so thank you for providing that.
Sure.
This next question is a good one. I don't think that we've ever directly addressed it, but this person wants to know if an employer provides Smart Choice for their employees, does the Smart Choice bundle cover family members of the employees?
Yeah, so the bundle itself, the Enhanced Care MD and the Connect that I just talked about, absolutely covers everybody in that employee family. If they go on to get insurance, then that's up to whatever they sign up for insurance, because they can go in and just get insurance for themselves, or they could get insurance for the entire family through our portal, and that's what makes one of the factors in what the price is going to be. Because there's one price obviously for a single, and another price for a couple, and then another price for a family as it relates to insurance. But the Smart Choice bundle itself does cover all the members of the household.
Perfect. Okay. This next question: does a 5LINX representative have to have Enhanced Care to market it?
Yeah, well, I've answered this a couple of times. Have to? No, you can try to do it. Here's what I always say to people. If you were trying to sell this to me as an individual, my first question would be, well, do you use it? And if you said no, I don't know how I would respond to that other than negatively, because I'd want to know, how does it work? What does it really work? Now, remember, we have a couple of different things. This is talking about Enhanced Care, not the insurance. So it really is, even if you have a Cadillac insurance plan, you should still have Enhanced Care, because it's going to save you money. It's going to have the convenience of not having to go to the doctor. You can take care of 80% of your problems on the phone. But it also is a selling tool for you. And by the way, it's one that you can write off as a business expense, because it is a selling tool. So yeah, do you have to? Is there a rule? No, but I don't know how you can do it without it.
Good point, and that's a good point with regard to all of the products and services 5LINX sells, and certainly if it applies to those, it applies to this product as well.
Absolutely.
Okay, so this next question is really about how the actual telehealth process works. And so this will give you an opportunity to talk about what actually happens during a telehealth consultation. So the question is, can the MD telehealth work on a smartphone, tablet, etc.? What kind of devices can be used for an MD teleconsultation? How does the MD do an assessment based on symptoms, etc.? So it sounds like what they're asking is it a telephone call? Is it a web video conference? And how exactly does the doctor do the assessment?
Those are great questions. I see this person is this is the same person has asked a couple of questions. That's great. So it can be done on any device. You do have an option. You can do, and I may have misspoken before because I said $5 for a doctor call. Or the computer. It's $5 for a phone call with the doctor. It's $15 if you go on the computer. And the doctor makes an assessment based on a couple of things. One is we have your personal history. When you join, you're going to fill out a personal history form. And then when you call in with your symptoms, that doctor has more information than you would get if you went to like an urgent care center, because they've already got it. So the doctor looks, you call up with a sinus headache, or you call up with a headache, and the doctor sees you've had a history of sinus headaches and you've been taking certain medications. That's already in the system. So they're making their assessment based on their just like they would do if you were there in person, based on their assessment of what they're hearing and what your history is. And if it's something that they think you should see someone in person, they'll tell you that. And it could be viewed on, as I say, on virtually any device.
Perfect. That's great to know. Okay, so next, what happens to the coupon that gives individuals the first month free?
Well, instead of giving the first month free, we're giving, and correct me if I'm wrong on this, Keith, but we doubled the points as opposed to giving the coupon. Is that correct, Keith? Is that the right way to say it?
That's spot on, Rick. And that promotion runs through the 27th, which is tomorrow. And I have no additional information about any extension. We'll just have to, stay tuned for that.
So that's the answer.
All right. So be sure to take advantage of that promotion. Okay. Next question is the $49 per employee paid by the employer or the employee? And does the employee only pay for the insurance in the marketplace?
Yeah, so there's no right answer for that. If this is a company supplying this, we have some where the employer pays the whole 49, some where they pay zero, but they just make it available for the people, and there's others where they share the cost with the employee. Remember, this total cost is $1.66 a day. So we're really not talking a lot of money for what you're getting as a benefit. But there's no right answer here. It can be whatever the employer would like to do. And then does the employee only pay for the insurance in the marketplace? Well, we have some cases where the employer is also paying all or part of the insurance for that person too. It just depends on each individual circumstance, and that's why, as we explained a couple of questions ago, the best way to do this is start asking questions when you talk to a company.
So it really sounds like it's up to how it'll work best for the employer, and the rep should really find out and make sure that they're aware that they can work it in whatever way will work best for them. Is that right?
That's right. That 40, and again, if the employer is already paying something towards people's insurance, what your job should be is to have them take part of that and of their first $49.95 that they've already been giving to them, and apply that towards the Smart Choice bundle. And what that's going to do is, if the person is on an individual going through the marketplace, they're going to end up paying a lot less for insurance than they did when they had a group plan. So it's really up to you as a rep need to find out what the hot button is for that customer, that employer, and what they want to do for the employees, and then work it out the best way. The best possible scenario for us is that the employer pays all of it, and it comes out, and we don't have to worry about payroll or credit cards or anything. It's just as an automatic payment right from the employer to all of us.
All right, thanks for clarifying that. Now, we've got just a few more minutes and a lot of questions. Thanks, you guys, for submitting all of your questions. Unfortunately, we are not going to be able to answer all of them tonight, but as I mentioned before, we will be able to get you answers to your questions over email over the next week or so. So I just want to let you know, if you didn't get your answer or your question answered tonight, you will receive an answer in the next week or so. All right, so just one or two more questions for Rick and Keith. The next one is, if a person is already on Obamacare, can they switch over to our Enhanced Care program?
Well, another loaded question. I'm not sure that I completely understand it. They can't after open enrollment period. No, they'd have to wait till next time. However, they can do the bundle anytime. So that's why it's a difficult question without knowing exactly what the details are. From an insurance standpoint, no, they're in, but from unless they lose their insurance through their whatever they have now. But from the Smart Choice bundle, they can do that any time of the year. It doesn't matter. But they can't switch over the insurance piece, yeah.
Okay, good to know. This next question, I have peaking cards and want to be sure about what exactly is the best contact info to put on there besides my name, phone number, and website. Would that be sufficient?
Yeah, I mean, it's sufficient. Sure. I mean, it's, whatever you do for all your other products as a rep, it's getting people, you want to be able to talk to them. And, Keith, do you have any other thoughts on that? I mean, I don't know what else. This shouldn't be any different than any other product that you're selling as 5LINX reps.
Well, actually, I'm not very familiar with a peaking card, but if you can have something on there that resonates with a business owner, and typically one thing that we know that resonates with all business owners is how you can save them money. So if you can make some assertions that you could save, you could potentially save the business owner money, typically that kind of thing moves the needle.
Yeah, I think this question, though, is strictly about the contact information. The peak cards, I'm assuming the peak cards already have the benefits, but this question was specifically about the best contact information. And again, I don't know what. Do you know, Charity? Is that generally what people do for the other products, as far as contact goes? I don't mean about.
Yeah, generally they put their RIN, their website, and some people put their phone numbers. I think maybe this person was trying to find out whether there was a direct Enhanced Care website or phone number that they should include as well.
No, you want to make sure it's going through you, because we can't we can't do the. What'll happen if you do that is we would be doing basically cold calling, and we can't do that. If that's what the question is, that's good. So you gave the right answer there.
All right, great. Well, that about does it for our time tonight. So again, I want to thank you, Rick, and thank you, Keith, for coming on this call and answering all the questions. And thank you, Dave, for that great presentation. And, of course, finally, I want to thank our audience. You guys had some great questions tonight. I'm sure that everybody on tonight's webinar benefited from hearing your questions and the answers that Keith and Rick were able to provide. So, again, thank you. Be sure to join us next Wednesday night for the 5LINX April Co-Founder webcast, and then the following evening, Thursday night, for our next weekly training webinar. This time it will be on text alerts. So please make sure that you guys go to the webinars.5linx.com site to register for those. And again, a recording of tonight's webinar will be available in the webinar library